As each day unfolds, there are more challenges to address. The National Cabinet will meet later today to consider further measures. What I want to say to Australians, though, today, as we've assessed the information this morning, this time last week the rate of increase on cases was up around 25 to 30% a day. That rate now, over the last few days, has fallen to about 13 to 15%. Now, they are still strong rates of increase, there's no doubt about that. But as we take the measures that we have been taking and we put them in place and we have the cooperation from the Australian people, then that obviously in turn has an impact on how we're managing the spread of the virus, but also how that impacts on our health system, on the population, on people's jobs and livelihoods. Today, what I'm here to do, together with those who are joining me, is to announce more support for the care of Australians. There are many things we have to address, whether it's income support or whether it's direct health support through our public hospital system, and it was only a week or so ago that the Health Minister and I stood here and announced $2.4 billion in additional support for the health sector, followed up by a further $600 million support for the aged care sector. So already there's $3 billion of additional funding support going into these critical areas. And today we're here to announce further support going into our health sector, but also into our welfare supports for those in the community who can be most vulnerable as a result of the changes that are taking place in daily life here in Australia as a result of the decisions that are being taken and the impact that they have in the community. But before we come to that, I also want to announce something very important for how we're getting information to Australians. Today, with the great assistance, and I want to thank them, from Atlassian and Facebook, we've been able to put in place the WhatsApp feature. And if you simply go into WhatsApp and type in oz.gov.au/WhatsApp, you will get access to a new messaging service which enables us to talk to more and more Australians, to provide direct information on a whole range of features in terms of basic health advice, updates on the measures that are being put in place by state and federal governments, and that can assist you get the accurate and timely information about what is being done by governments around the country to support you as you and your family and your household and your community work through the difficult months ahead because of the coronavirus. I can also say that on the App Store, the Apple App Store, the coronavirus app you can now download. I did that this morning. That is available, and that is doing exactly the same thing. That's providing further information, more resources, a trusted place of advice and information that you and your family and your business can use to understand the decisions and the information that is available to everybody about what is occurring with the coronavirus. That is an official source of information, and I would ask for the support of media in promoting those channels where people can get access to that information. So oz.gov.au/WhatsApp. And the coronavirus app, you can simply do that by going to the App Store. I did it this morning. I just typed in search on coronavirus, and the Australian government app came right up and downloaded it, and the information is there for people to get access to it. But today we are announcing also support of $1.1 billion, which has been foreshadowed today. Now that is being done in 4 tranches. There is the Medicare subsidised telehealth services, so people can continue to get access to quality health care when they're at home. We're asking Australians to stay home, particularly older Australians, even more so. And we want to ensure that they continue to get access to health care and health advice and support from GPs, and this is why this measure is being put in place. That's some $669 million, getting health services into your home. Secondly, we're announcing $74 million for mental health support, and the Health Minister will take you through more of the specifics of that when he speaks. We're putting $150 million into support for domestic violence initiatives. I've flagged with you in recent days my concerns and the National Cabinet's concerns about these issues. Google has shown a 75% increase in searches when it comes to issues around domestic violence in recent days, and we need to put more resources into supporting people who will be vulnerable and may be vulnerable, and we are putting that support in. And that will ensure that those services, whether it's a men's line or whether it's the 1-800 Respect line or any of these types of lines and support, as well as others, will get this funding that they need to be able to provide the services that are so essential. We're also putting $200 million into emergency relief support. So that will be provided to support charities and other community organisations which provide emergency food relief as demand surges as a result of the coronavirus. These services are demand-driven, but we anticipate the funding boost, which is more than 4 times annual funding, will help hundreds of thousands of Australians in most urgent need. The funding will be shared amongst existing providers, including Food Bank, Second Bite, Oz Harvest, the Salvation Army, St Vincent de Paul, Anglicare and many other local community organisations. And to find your closest emergency relief provider, you can go to the DSS government website, and that information will be available to you, but many who already access those services will know where they are and what they do. We will also be moving to provide further income support. The Treasurer and I have been working together with Treasury and other officials night and day over recent days to ensure that we can provide further boosted income support across the Australian economy. We're being very careful to ensure that that income support can be delivered in a way that gets it to people as quickly as possible using the existing systems that we have. When we do these things, it's not a matter of just cutting and pasting ideas from other places. We need to have solutions that will work in Australia. And so our approach has been to apply the discipline to the design of measures to deal with unprecedented levels of demand. And we've even seen where we've moved as part of our second stimulus. It's not a stimulus, it was a safety net package. Our second safety net package, that even with the significant ramping up of capacity through Centrelink and other government services, that was fairly quickly overwhelmed. And so we're learning from that and ensuring that the measures we seek to put in place next will be able to be distributed even more effectively. So it isn't a matter of whether more income support for workers and for employees is needed. It's a factor of the design of the delivery of that support. You just can't cut and paste someone else's system, because we've seen in many other jurisdictions that are putting these in place, they are having to rapidly redesign them and change them. You've got to have more detail from the outset to ensure you have the most effective implementation. So I would say to employers who I know going through very difficult times, these changes will be announced soon, and I would ask that before you make any further decisions, that you take the opportunity to see the further measures that the government will be announcing, and will be seeking to enlist you in that process, and we'll be ensuring also that those who have already gone into this very devastating situation where they have had to stand down workers, that any measures that we're announcing will be taking them on as well, and will be working with them to that end. Finally, I would say that overnight, when the midnight ban came in, I should say the midnight quarantine arrangements came in place for returning travellers, those arrangements have worked relatively smoothly, is the advice from the Chief of Border Force. I spoke to him this morning. The number of passengers was actually down on what might have been expected, and I want to thank all of those state and territory authorities. I want to particularly thank those in New South Wales, which had to shoulder half the burden this morning. On the numbers through to this morning, New South Wales has been dealing with half the number of cases of people who have been coming in. They've got great support from the ADF, great support from the Australian Federal Police. The New South Wales agencies have done a tremendous job. There's also been the very difficult challenges in Western Australia dealing with those cruise ships. And again, I want to thank the Western Australian Government, the Western Australian Health System, the Border Force, the ADF, everyone else, the private hospitals that have come to the aid to support us. Everyone's working together, and everybody's working incredibly hard to deal with the unprecedented level of demand and changes that are necessary. And for right now, It's about getting more support to people in the community that need it most, and that's their health care, that's their mental health, that's their protection for vulnerable Australians, and that emergency relief, and that's what this $1.1 billion package I've announced today will be addressing. Greg.
Thanks very much, Prime Minister. Today is about taking care of our vulnerable Australians, all Australians, and in particular our GPs and our nurses. It's about support for health and mental health at a time of the most profound and understandable stress, whether it's because of concerns relating to income, whether it's concerns about a job, or whether it's the direct fear or contact that people may have in relation to the coronavirus or other issues and the ability to get the support. Anxiety, the possibility of depression, loneliness, isolation, the need for access to services, all of these are real. So these are the things which we're seeking to support with changes that would otherwise have taken 10 years being done in 10 days. And I want to thank both Michael and Christine for their support on that. Just before addressing the specific mental health and telehealth measures, I do want to provide a brief update on some of the national progress. The most important development is the one that the Prime Minister has outlined in terms of the positive early signs of flattening of the curve. This is the work that Australians together, both governments, but above all else the people, have been taking. As the Prime Minister said, from daily rates of increase a week ago in the 25% and 30% rate to now on our latest advice from the National Incident Centre this morning to being in the low teens, that is an early positive sign. We have so much more work to do, but by people isolating, by people being able to social distance, and they are really doing this. Australians are rising magnificently to this challenge, and we want to say thank you. And to those small few who aren't, you have to take these measures because these are about saving lives. They're not about convenience or inconvenience, they're about saving lives. Part of this has been the testing regime. As of this morning, our latest advice is that there are 209,000 tests that have been completed in Australia, a more than 98% negative rate. What that really means is that with the 3,809 cases reported to us, we have one of the broadest and most reflective testing regimes, and this is borne up by the secondary evidence that at this point in time our loss of life, as terrible as it is well below 1%. It's below 0.5% of those confirmed. Now that will change, we know that, but it continues to be a recognition that the evidence we have is at the global forefront. At the same time, 750,000 telehealth services have already been delivered in only a very brief period of time. So that brings me to the measures which the Prime Minister outlined. Firstly, let me deal with mental health. In particular, it's $74 million directly, but we believe about $300 million when you take into account the telehealth services. There are two parts to this. There's the preventive work, and I want to thank Christine and for her work, Michael Gardner from my team, and all of the mental health professionals who've helped pull this together. Counselling and support services, $10 million for BeyondBlue, $14.5 million for Lifeline and Kids Help and for other groups. Our vulnerable Australians will receive a very, very significant package of $45 million, and that includes $10 million to support older Australians, $3 million specifically for our health workers because the pressures they are under are real. These are our heroes at this point in time. These are the people who are putting themselves out there to protect Australians. $7 million for young Australians through Headspace, and then an additional $28 million to support, to provide psychosocial support going forward. Those that have trouble accessing services, who are on the margin sometimes, will be supporting them. So all of that going together, the counselling and the vulnerable, and then an information campaign which begins this evening to assist with that. But that then brings me to telehealth. And telehealth is vital for mental health and for physical health. What we are doing now is a radical transformation in the way in which we deliver our health services. As of tomorrow, we will have universal telehealth array available in Australia. It's not the money, it's a $669 million program, as the Prime Minister said. It does two things. One, for everybody who is self-isolating or is under formal isolation or formal quarantine, that means you can ring your doctor, whether it's your GP, your specialist, your mental health psychiatrist or psychologist, your allied health practitioner, or your nurse practitioner. All of these are available. It's a decade's worth of work in a matter of days, and I want to thank Professor Michael Kidd and his team for pulling this together. He has had the support of the AMA, the College of GPs, the Council of Medical Presidents from all of the colleges, rural doctors, Indigenous groups. They've all pitched in magnificently. What these services will mean is that every Australian anywhere can get the help that they need. We're also doubling the bulk billing incentive and making that available both for face-to-face and for telehealth consultations. And we're providing a doubling of the practice incentive payments for those general practices that continue face-to-face consultations. That's very important because so many health services still need to be face-to-face, involve examination, involve physical consultation. And I want to thank our general practices for participating in this. So these services, very simply, are about saving lives and protecting lives, about supporting our doctors, supporting our patients, and protecting Australians with their mental health and their wellbeing. I might invite Christine and then Michael.
Thank you, Minister, and thank you, Prime Minister. And I would like to reflect the thanks that has been expressed to every Australian who is really embracing our concept of physical distancing but with social connection. As we have said so often, mental health is as integral to who we are as our physical health. And what we're seeing today is the Australian system, as our Prime Minister has referred to it, being opened up, being flexed up to ensure that the mental health and wellbeing of every Australian, whether we come into this mentally well, whether we come into it mentally ill, whether we come into it mentally challenged. And at that point, I'd like to stop and just remember so many Australians who have recently been through the scourges of our drought and our bushfires who are already suffering, and to remember that their mental health and wellbeing is important. Today's package reflects the importance of trying to prevent mental unwellness, but also to ensure that we provide treatment for any who need it. It covers our vulnerable Australians, our frontline workers, as our Minister has said, and all Australians. And I commend the work that so many have done for it. But I would also like to stop and reflect on the fact that as we must practice physical distance, and as we all embrace the concept of loneliness that can go with that, for too many Australians today, that also encompasses a sense of fear. As our Prime Minister has said, home is not always safe. If only it could be. That is certainly something we would all embrace. But the reality is that for too many, it is not safe. And for those who are at fear or facing the reality of any form of violence in their environment, it is incredibly important that, being physically distant, we nevertheless remain very connected, and we provide all opportunities for anyone in those circumstances to find a way to reach help. It is impossible to be going through that degree of fear, that degree of what is happening to me without being mentally affected. Now, our mental health services are yet another avenue of support. Today's package, as the Prime Minister has said, provides support for those known services, and I urge any Australian who needs them. 1800 Respect, Men's Line Australia, the counselling support services. They are there for you. But also know this, that any mental health service that Australia provides is there for you also. Do not hesitate. Use any avenue you can. We are there to help. We are there to support. Whether you're living with the fear of it as a potential victim, whether you're living with it as the horror of a potential perpetrator, we are there for all Australians. Our mental health and our mental wellbeing is a foundational piece for us to be able to get through this pandemic. There are so many positive signs. We've heard it in the bringing down of those increases. There is hope. There is a future. We need to do it together, and we need to be there for all vulnerable Australians. So I encourage all of us to remember and look after our mental health and wellbeing, to access our mental health services, and for those who may be afraid, we are there for you.
Prime Minister, on the significantly enhanced support for businesses to help pay employees that both you and the Finance Minister have confirmed this morning through the existing tax and transfer system, you're asking employers to hold off making further layoff decisions until they see that package in the coming days. Would you envisage it to still only apply to SMEs, or to have a broader application to potential bigger publicly listed companies such as Qantas or Premier Investments, for example, or just SMEs?
Broader application, John. I mean, the waves of economic support that we've put in place have had the feature of being scalable and the feature of actually working through existing channels wherever possible. And those packages are focused on the most immediate needs. The last package that we announced with the Treasurer was about broadening and strengthening the safety net for those who are going to be immediately impacted by the shock of losing their jobs. And the next stage, which will be even bigger than anything you've so far seen, will go broader than that and ensure that we're working together with companies to keep people connected to companies. This is part of the hibernation strategy of ensuring that we keep people connected with their businesses and with their jobs. So on the other side of this, Australia can bounce back stronger. This is going to be incredibly tough economically as well as from a health point of view. But where Australia can ensure we can bounce back better on the other side and more strongly is by following these sorts of strategies which enable businesses to re-emerge very, very quickly with their employees, with their capital, with their equipment, with their shops, with all of the things that they can switch on again and get moving again. That is in the long-term interests of Australia. Certainly this health crisis and economic crisis, a battle on two fronts, is going to be waged in an unimaginable and unprecedented way over the next at least 6 months and potentially beyond that. But the battle we need to win is for the long term as well, and that is that the businesses are able to resurge and we can get Australia back to life as we know it again, as we have known it, I should say, as soon as possible once the virus passes. Michelle.
Mr Hunt, for some time we were hearing that the official medical advice from your top committee was unanimous. Now, the other day, Dr Kelly acknowledged that the Victorian Principal Health Officer had a different view. Could you explain the differences, please?
Sure. Look, very briefly, and I'm not inside the medical expert panel. We very specifically want them to meet. I think, like every group, they discuss, they take the best advice from communicable disease network experts, virologists, epidemiologists, contagious disease, communicable disease experts. They bring their views. They have been magnificent. They have been magnificent, and everybody will come with different ideas and different views, but my understanding is that ultimately their decisions have been consensus decisions. As in every group, when you make decisions, there are multiple inputs and people will have different views. But I have to say, one of the things that the Prime Minister did when COAG met before it became the National Cabinet a few weeks ago was achieve two fundamental things. One, the primacy of a single national unified voice. The medical experts panel and all of the states and territories agreed that at the Prime Minister's request, and they have operated as a single national unified voice. Secondly, out of that came the concept of a single national unified government, the National Unity Cabinet, and those two elements are essential. So differing views will come in, but one voice has come out, and that is the national medical voice. And I just want to say our Chief Health and Medical Officers, they have been working 18 hours a day, and to thank them for their extraordinary guidance.